Hi friends, today let's start discussing about the scapula, that's the shoulder blade. Scapula. Now, how do you determine whether it is left side or the right side? First, first of all, let us see how to determine the side to which it belongs. Now, the dorsal surface. This is the costal surface because this surface it faces the ribs, our ribs, so it is referred as costal surface, and this is dorsal surface. The dorsal surface, it is divided by the spine of the scapula into the upper one third and the lower two third. So we can say that this is the dorsal surface, and the lateral border is thickened, somewhat thickened. Lateral border is thickened, and at the lateral angle we have the glenoid cavity where there is articulation of the head of the humerus takes place, and the medial border is somewhat it's thin, and the coracoid process is directed forwards and medially. It's a type of atavistic epiphysis. Now, we can make out that this is a right scapula and articulates with the right humerus. So now let us start with the other features of this bone. It has three borders: the superior border, the medial border, and the lateral border. And it also has a three angles. One is superior angle, inferior angle, and the lateral angle. The lateral border, it originates from the inferior tubercle till the inferior angle, and the medial border from the superior angle to the inferior angle, and the superior border from the superior angle till the suprascapular notch. This a notch like thing is called a suprascapular notch, deepened one. This is suprascapular notch, and this is supraspinatus fossa, the upper part, and the lower part is infraspinatus fossa. And this is the acromion process of the scapula. Acromion process of the scapula that articulates with the clavicle. It bears a facet. See here, this is a facet that articulates with the lateral end of the clavicle. Now the borders are over, the angles are also over, and the lateral angle is broadened to form the glenoid cavity that articulates with the head of the humerus, Now coming to its attachments of the scapula. Now this is a crest of the spine of the scapula, and it has two lips. One is upper lip and the other one is the lower lip. This is the lower lip. The upper lip gives insertion for the trapezius muscle, and the lower lip gives origin for the posterior fibers of the deltoid muscle. Now the supraspinatus muscle, it takes origin from the medial 2/3 of the supraspinatus fossa, and the infraspinatus muscle takes origin from the medial 2/3 of the infraspinatus fossa present on the dorsal surface of the scapula. Now the origin of the inferior angle is covered by the latissimus dorsi muscle, and the superior angle is covered by the trapezius muscle, and also the supraglenoid tubercle, where there is the origin of the long head of the biceps brachii, and infraglenoid tubercle, the origin of the long head of the triceps brachii. In supraglenoid it's biceps, and in infraglenoid tubercle it's triceps. Okay. Now there is a continuation between the supraspinatus fossa and the infraspinatus fossa. This is called glenospinal notch. Now this is the coracoid process. It gives insertion for the tip of the coracoid process gives insertion for the pectoralis minor muscle, and the medial border gives origin for the coracobrachialis muscle, and the short head of the biceps brachii also arises from the coracoid process. And now the root of the coracoid process, it gives attachment for the coracohumeral ligament. The root of the coracoid process gives attachment to the coracohumeral ligament, and this is the costal surface, and the medial border gives insertion to the serratus anterior muscle that takes origin from the first 8 digitations of the ribs, and the lateral 2/3, the lateral 2/3 mainly gives origin for the subscapularis muscle, a multipennate muscle. It's a subscapularis muscle. And the suprascapular notch, here is the presence of suprascapular notch. It is this notch is connected to the foramina by the help of the ligament, that's transverse suprascapular ligament, through which the suprascapular nerve comes and divides into the superior and the inferior. The superior supplies the supraspinatus muscle and the inferior supplies the infraspinatus muscle. Now coming to the insertions. From the superior angle till the root of the spine of the scapula, we have the insertion of the levator scapulae, and at the root of the spine of the scapula we have the insertion of the rhomboid minor, and from the root of the spine of the scapula till the inferior angle the insertion of the rhomboid major muscle. And then this is there is a presence of a glenoidal labrum, which is deepened for the articulation of the head of the humerus with this glenoid cavity to provide stability. And now this acromion process tip and the coracoid process are attached with the ligament called as the coracoacromial ligament. Okay, coracoacromial ligament. And that in the clavicle bone we had the trapezoid and the comoid parts, which gives attachment to the coracoclavicular ligament. So the coracoclavicular ligament, it takes origin from the coracoid process, then attaches to the trapezoid ridge and the conoid tubercle of the clavicle bone. Now coming to the clinical anatomy, the serratus anterior muscle, which is attached to the medial border of the costal surface, it gets paralyzed. When it gets paralyzed, the medial border and the inferior angle is prominent. So the person where there is a damage to the long thoracic nerve that supplies the serratus anterior muscle, he cannot over abduct his arm. In that case, the medial border of the scapula as well as the inferior angle are prominent. The medial border and the inferior angle are prominent. That's it, guys. Thanks for watching. Please do subscribe my video. Thank you so much.